Well, with more than 2 million sufferers, Australia has been identified as a hotspot for asthma. So any news of a possible breakthrough is always welcome. Well, tonight we have the results from a trial in New Zealand showing how a simple pill is effective in reducing the symptoms and getting chronic sufferers off their medication. Laura Sparks has this exclusive report.
It's been miraculous for us because it's just made so much of a difference to his health.
It gave me freedom to run around and not use those inhalers.
It's restrictive.
All your chest was tight and cloggy and it was hard to breathe.
Ruins your sleep.
Normally I'd wake up and use the blue inhaler to stop me from getting wheezy.
And doctors warn it must be taken seriously.
Kids can die from acute asthma.
Australia has one of the highest rates of asthma in the world. 1 in 10 suffer from it. Tonight we reveal an all-natural remedy with the potential to save millions of lives. It might look innocuous, but inside this tiny pill is a magic bullet. Fatty acids extracted from the New Zealand green-lipped mussel, a seafood product found on the South Island here in New Zealand. And it seems to have a natural healing agent for some severe health ailments, like osteoarthritis. And now a study here in Auckland is proving that it's helping kids with asthma.
It was absolutely fantastic. It was just, he was so much happier. There was not all these hospital trips. There wasn't the drugs. EXP.
Expert.
Okay.
Colleen Brady has become something of an expert. Her son James suffers severely.
We would have probably been at the hospital at least once every 3 weeks.
Obviously such a basic, important thing to breathe, so when your child is struggling for breath, you worry about that.
Tom Bogdanovich not only worried about his son Noah's asthma, but also his daily need for preventer medication, corticosteroidal inhalers.
We were keen for him to ease off the steroids if possible and cut down on the inhalers.
Then he heard of a new study searching for asthmatic kids to trial Lyprinol. Study leader and GP Dr. Jim Lello wanted to make sure the seafood pill could help asthmatic children without causing allergic reactions. Were you sceptical?
I think that any practicing doctor is sceptical about nutritional products having big claims for them.
And Lyprinol has some big claims. Green-lipped mussels have the highest concentrations of omega-3 fatty acids of all seafood.
Omega-3s are found in lots of different things. It is particularly well focused in green-lipped mussel, which makes it a little power package of omega-3 anti-inflammatory activity, which means a small amount contains a lot of anti-inflammatory material.
Pharmacist and medical herbalist Gerald Quigley has been prescribing Lyprinol as an anti-inflammatory for his osteoarthritis and asthmatic patients for years.
Any nutrient that we can use to relax those muscles, in a similar way to what the drugs do, the inhaled steroids do, has got to be worth considering.
Half the 70 children on the trial were given Lyprinol and the other half a placebo. So before you started on the Lyprinol, how many puffs did you have to have morning and night?
I had to have 6 puffs in the morning and 6 puffs at night.
5 months into the trial, James is down to just 2 puffs daily.
Before he was on the Lyprinol, I would have been at hospital with him in a 6-month period, probably 7 or 8 times. After he was on the Lyprinol, it's been 2 or 3 times a year at the most.
It just seems easier to breathe because before the air was struggling to go down a bit and come up.
I could run around a bit more without getting a little bit of asthma. Okay, I'm trying.
Noah's sleep improved and, like James, his doctor slowly decreased his reliance on inhalers.
Yeah, at the peak he was taking the steroid inhaler about 3 puffs twice a day, morning and night, and I think after taking the Lyprinol for a while it went down to about 1 puff once or twice a day.
Dr Lello warns this doesn't mean asthmatic kids can give away their puffers, a warning echoed by Asthma Foundation CEO Michelle Goldman.
The important point is that parents should not be giving their children Lyprinol in place of medication, that it should be used in addition to the medication prescribed by their doctor.
But it seems the tiny natural pill does pack a big punch.
And it was just, it was great. I just couldn't believe something as simple as taking this capsule had helped him so much.
Some good news there. Laura Sparks reporting.